How's it going, guys? Welcome to episode 105 of Talk4, the quickfire podcast, where we ask four great questions to unique and interesting people. Behind the mic today is your host, Louis Skupien. That's me. And let me introduce our very special guest for today, Dr. Joe Dituri, also known as Dr. Deep Sea, who's going to be answering a few questions today. So, Dr. Deep Sea, Dr. Joe Dituri, whichever you prefer, how's it going today? And welcome to the show, man.
Thank you, Louis. Hey, I'm ecstatic. My day could not possibly be better. Look at the talking that I'm on. This is great.
Absolutely, and now you're looking good there. And well, I figured we'd kick this off with the quick kind of introduction. So you've gone up to the bar, you're having a quick 30 to 60 second kind of elevated pitch to someone you just met. Quickly describe, what the day job is, and just kind of a little intro into the life of you.
So if we're in a bar, my usual thing is, hi, my name's Joe, and I'm an unemployed fishing charter boat captain. I don't tell anybody what I do. But as it stands, I did 28 years as a diver and special operations diver for the United States Navy, active duty service, retired, went back to school, got a Ph.D. in Biomedical Engineering, and now I teach at the University of South Florida, and I teach medicine, and I work in hyperbaric medicine. I'm trying to cure traumatic brain injury, so that's where we're looking.
Wow. Well, I mean, looks like you're doing fantastically. And before we dive right into the questions, we spoke about this just before we went on the podcast, but quickly, and if you were to describe what going 0G in the 0G jet is like, I mean, very, very jealous of that one. That's absolutely a bucket list one for me. But yeah, so how was that?
So it ties into all the work that we did in the undersea realm. So basically, which ties into being an astronaut. So getting from here to Mars is a long transition. People want to get there. I'm just looking to facilitate that. So this whole zero gravity thing, it's truly not zero gravity, right? And this is the misnomer, right? It's not no gravity. It's just that for every foot you're falling forward, you're falling 1 foot down, 1 foot forward, 1 foot down, 1 foot forward, 1 foot down. And you're constantly in free fall around the earth, right? So that's really, truly what's going on is free fall. So when you do these parabolas, you're in what's called microgravity. Absolutely amazing, incredible. I got to, water, like the little bit of water that was, nice, good stuff, fun. Really an interesting version from being underwater most of the time. So really
Yeah,
cool.
absolutely. No, a past guest who I got the chance to speak to and also got to fly with as well was Aaron Fitzgerald out of the Red Bull aerobatic helicopter, and he was talking about the parabolas and the 0G stuff, and it's quite similar to what he does with the flips in the Red Bull helicopter, which I got to try as well, which is great fun. But one day I would very much love to experience what it's like to do that, not strapped into a seat. So maybe one day it's going to happen, but for the meantime, enjoyed watching you do it, that's for sure.
I hope so. Yeah.
Absolutely. Well, okay. So question one, I love to go into a bit of backstory to start off with then. So as you said, and obviously what I've read on the website is you had, like you said, a lot of time in the Navy doing diving, active service, 28 years, I think it was on the website. So as someone who quite regularly speaks to veterans and service members, can you give us like the quick rundown of the military career you had, what your role was, and if anything in there kind of laid the groundwork for what you're doing nowadays?
Sure. So I was a diver and a submersible expert. I was in charge at Deep Submergence Unit when we brought on the new submarine rescue assets, brought those on, and then I would, long term. I started off as an enlisted guy, by the way, became an officer, worked my way up through the ranks after 10 years, became an officer, earned a commission, and then commissioned into the special operations pipeline, and I did diving and salvage and some sort of explosive ordnance disposal diving, but not a whole lot of that. But I segued off into diving very well, became a saturation diver, became an expert at ship salvage and diving stuffs, did that a bunch, and then became in charge at Deep Submergence Unit. And then from there, I transferred to Special Operations Command here in Tampa, Florida, where I helped design and build dry combat submersible for U.S. Special Operations Command. Very fortunate in my 28-year Navy career that I got to do all these things and work with all these people. But upon retirement, I wound up stumbling into Admiral McCraven was my boss. And he said, well, what do you want to be when you grow up? And I said, well, I'm not really sure, but I don't want to do the military thing anymore. Long story short, he wanted me to help him with getting beaten up by Congress for 22 a day, taking their own life.
Yeah.
So I tried to help him with traumatic brain injury and PTSD, and I'm still doing that to this day. So that informed my decision of what I really wanted to be when I grew up.
Got it. So, forgive the ignorance potentially, and I hope I don't get any groans from the audience asking this question then. But so obviously I'm from the UK. I'm familiar with the UK military, and I've been speaking to quite a few people out of the US military and stuff too. But you mentioned obviously you're a diver. You had work with the special forces. Is that a separate thing from the Navy SEALs, or were you kind of working with the SEAL teams, or how did that look?
No, that is a great question, and thank you for asking. I am not a Navy SEAL. Nobody has ever shot at me. I have an aversion to lead. I think it's a poisoning. I'm not really, but what we do is the special operations community breaks up into three separate parts: explosive ordnance disposal, explosive ordnance management, and diving and salvage. So all three of those parts were special operations. So I segued into a little bit of EOD diving and then mostly the special operations diving, but that is a special operations officer. A SEAL is a special warfare officer, right? So one is special operations community, the other is special warfare. So it's a bit disingenuous when people say, oh, you were a SEAL. Not even a little bit. So I don't like to claim what I'm not. I'm very good at what I am, but I know what I'm not.
We look at your name on the internet as something. I go for a Google search and we search you up. The first thing that comes up straight away is the story of your 100 days underwater study. So let's excuse the horrendous pun, but let's dive into the deep end with that one. What were you?
I see what you did there.
I know you see what I did there. What were you studying exactly there? Now, what were your findings out of that? So just kind of run me through like what the objective was and what was the outcome.
So first of all, I have a PhD in biomedical engineering. So what we did was we did biomedical engineering on the one subject that was underwater for 100 days, me, right? Blood, urine, saliva, electrocardiograms, electroencephalograms. We did more science underwater than anybody has ever done in the past 40 years. Like basically since CLAB, since the end of the CLAB era in the United States Navy history, nobody's done this much research. So it was colossal undertaking. Second thing we did was we wanted to talk to a whole bunch of kids about science, technology, engineering, and mathematics, and we crushed that. And then we wanted to interview people about preserving, protecting, and rejuvenating our marine environments. So all of that pulled together, that was the purpose of what we did. The findings that I had were very closely related to exactly the findings of hyperbaric medicine. Hyper just means more than, baric means pressure. So while I was underwater for 100 days, I was at more pressure, right? So I was in hyperbaric medicine, just like if you were to be inside a hyperbaric chamber, right? So this hyperbaric chamber that we go in, that you can just go in on a regular basis, you can pay to go in it has some mechanisms of action. The mechanism of action were all the things that we saw. 50% reduction in every single inflammatory marker, an increase in the length of my telomeres, a decrease in cortisol causing a corresponding increase in testosterone. Yes, testosterone, right? But some of the bad things that happen, I mean, there's a whole host of other good things, including cognitive enhancement and, speed increase, so forth and so on. A 50% increase, 50% increase in sleep. I went from 30 to 33% in both deep and REM, moved up to 60 to 66% in both deep and REM sleep. Colossal. In the United States alone, 50 million people suffer from sleep issues, and my sleep was spot on great. Some of the bad stuff, like you said, there are some bad things, right? So the goods come with the bad. I shrunk by 3/4 of an inch. Now, what happens is astronauts are in tension. They're constantly being pulled apart by that gravitational swing that we talked about earlier, right? So aquanauts are in compression. So my spine was being compressed. Now, interestingly enough, when I did my zero gravity flight, I just got that 3/4 of an inch back. And it has been 9 months since I came out of the water. It's been 9 months. So I just got that 3/4 of an inch back. So, but yeah, there's a couple of other good findings, a couple of other bad findings, but by and large, we felt that it would track down that path of hyperbaric medicine, and truly it did.
Why is it so effective? What does it do? And why is it so effective in these treatments? And why did you see that increase in sleep? I haven't really done much looking into hyperbaric medicine. It's something I've heard a little bit about in my time, but from what you can explain to me, at least in a nutshell, what is that, and how does that affect you, and why was that so effective?
Right. So hyperbaric medicine has a couple of what we call mechanism of action. Truly, every medicine in the world has something called a mechanism of action, right? So how does it work and why does it work? One of the mechanism of action is an anti-inflammatory. So when you can go in hyperbaric medicine, it decreases the inflammation in your body. So why is that important? There are things that cause systemic inflammatory response. COVID causes systemic inflammatory response. Lupus, Crohn's, ulcerative colitis. Those are diseases of inflammation or inflammatory responses. So if you can get an anti-inflammatory that's natural, that doesn't do what steroids do and put 15 pounds on your waist, then you can definitely get through these things, right? So, but this is a short-term cure. It's not a long-term cure. But what you hope is that you bring the response down in your body, you chill your body out, then your body can heal itself. So hyperbaric medicine doesn't do anything to heal anything. What it does is it helps your body to help heal itself. That's it, right? So these mechanism of action, that increase in pressure, for instance, the sleep, nobody really knows why you sleep better. But what we do know is that hyperbaric oxygen increases your metabolism, right? So I'm thinking if you increase your metabolism, you're more tired at the end of the day and you sleep better. Don't know why. I don't know whether it's the pressure. We're still working this stuff out. This is going to be worked out for the next 100 years, I'm sure. I mean, hyperbaric medicine is not new. It has been around since 1640. That's right, 1640. 400, almost 400 years it's been around. You know, it's like, holy mackerel. This stuff is not new. It's not a new science. We treated the 1918 flu with hyperbaric medicine. We treated leprosy with hyperbaric medicine. We haven't had leprosy in a minute, right? You know?
Why haven't I heard of this so much before? I mean, have I been living under a rock, or is this really like obscure and it's starting to come out a lot now, and the research is starting to be done to a larger extent nowadays? Whereabouts is that in terms of the public eye, would you say?
No, because you haven't heard of it because bad shoe salesmen promise bad things, right? And in the beginning of hyperbaric medicine, we didn't really know why it works, right? We because in science, look, I'm a scientist, right? You need to know the mechanism of action. So you need to figure these out. And if you can point to it through a peer-reviewed, double-blind, placebo-controlled study that can be repeatable, or a prospective study, you know, something like that, that is repeatable by other people, then and only then is it good. So unfortunately, in the beginning, there were some shysters that got involved, people that just didn't, you know, 1700s, the early 1800s, the 1900s, the early 1900s, they were trying to cure toenail fungus with it. They were trying to cure this, that, and the other thing, you know, and unfortunately, it doesn't work. But when I tell you it's going to work and you pay me, that makes me a bad person. So I don't do that. If I'm going to treat you for anything, off-label. Off-label being there are 14 approved indications for which insurance will pay in the United States, will pay for you to go to hyperbaric medicine. And that's gaseous gangrene, carbon monoxide poisoning, decompression sickness, arterial gas embolism, stuff like that, crush injury compartment syndrome. Those things are paid for. But we know the mechanism of action. So if I can apply it broadly, so we know it's an anti-inflammatory, if I can apply it broadly to something like Crohn's, we try it, but we can't promise anything. You see what I'm saying?
Yeah.
We'll give it a shot. So it's just bad advertising. And frankly, the old white guy club was not doing a real good job at monitoring and policing it. But while I say off-label, right? So we use 14 approved indications, and then the other stuff is all off-label. What's the use for Viagra?
I think
No, come on.
Well, it's staying hard.
Right? So you would think that it's for erectile dysfunction. However, its approved use by the FDA is for as a cardiac drug. It turns out that it helps with erectile dysfunction, and it is prescribed more and always off-label for erectile dysfunction, but its on-label use is as a cardiac drug. So to say that something is off-label or we're using it off-label to treat traumatic brain injury, this is not a problem. Now, I'm not an MD, I'm a PhD, as I admitted to everybody right in the very beginning, right? All I do is teach people stuff. I'm like, hey, look, human physiology, here's the way it works, here are the mechanisms, go forth and do something, doctor, right?
Yeah, understood. Well, this is really interesting, and it's putting a few ideas in my head. Actually, thinking about it, actually, someone who I was very, very close with, so my background, to just give a little bit of context, was in tennis, and I was a tennis player from 4 to about COVID time. Realistically, as a professional player, I did very well. Probably one of the hardest working athletes I had the pleasure of working with. Her name was Tanisha, and the epitome of someone who works just fantastically hard on the tennis court, and diet down to a T, literally, supplements, the lot, anti-inflammatories. COVID happens, and she got long COVID, and then had chronic, I think it was inflammation of the heart, and now is unfortunately disabled in mobility scooter, probably been at it for about 2 years now, with the kind of the resting heart rate being so significantly above anything considered to be normal, and having to recover really for days at a time after even just going out for a walk or seeing friends for an hour, although it's getting slightly better now. But it kind of puts into perspective, like, if I haven't heard of this before, who has? And if I could take something away from knowing about this medicine, or if she could, for example, where would you begin in terms of like seeking something out there? And is there anything that I personally can take away from it or implement from these findings too?
Right. So without getting into too much detail, it sounds like she has something called endocarditis or myocarditis. That's a common impact that came from COVID. So that kind of sort of isn't COVID long hauler. Usually the COVID long haulers have, brain fog and reduced vital capacity, and hyperbaric oxygen might be able to help with that. However, you have to know, right? So you have to know a little bit about medicine, and you have to talk to a medical doctor. I suggest that she go and be evaluated by a hyperbaric facility to see if she could get in. But you need that medical doctor to approve you.
Yeah, understood. Okay, so moving forward with that then to something else I'm very, very interested in terms of the topic. So I've, like I mentioned at the beginning, spoken to a lot of veterans, many of which who have had PTS, TBI, and some of them have just beyond incredible stories, and some of them have gone down different routes in terms of the way they've gone to recover. So as a massive advocate of veterans' mental health. In fact, I'm starting a project to help fund some of the foundations that I've had the pleasure of speaking to. But I saw that you are obviously the president of the Undersea Oxygen Clinic, and I've heard about the TBI work that you're doing, and obviously, like you mentioned, the stuff on yourself. Like I mentioned as well, some of these people have gone down different routes. Some of them have done the TBI brain resiliency training. Some of them have done sleep therapy boot camps. People have even gone to the psychedelic side of things with like ayahuasca and ibogaine. I was wondering if you could tell us a bit about what the treatment method is exactly for the veterans there, and what are some of the kind of results that you're seeing for the TBI and PTS, and maybe interlace a bit of like how it's going for you now as well.
Right. So stumbled upon this while I got my traumatic brain injury from my car accident, right? And what I found is that no one cure is enough. That's the God's honest truth. And it's unfortunate, but in science, I want to know the one thing that works most best, right? And then I want to find out the mechanism of action, and then I want to do a double-blind, peer-reviewed, placebo-controlled trial, and then have it redone again. No. We don't, you can't do this with the brain. We have to look at it differently. Let me give you an example in the knee. So in the knee, which is a very simple joint comparatively, like compared to the shoulder is 6 degree of freedom joint. The knee is really a simple joint. However, a knee surgeon will always be like, oh, I want to go into your knee to look. But I said, you have imaging. No, let me go in and see what I can do to clean stuff up. So the guy goes in to my stepdaughter's knee and looks at it and winds up just clipping this little thing called a plica, which is like a 1 millimeter little tip on the end of a bursa sac. But that little 1 millimeter thing was causing all the problems, yet the imaging couldn't even see it. So I'm thinking to myself, we don't pop top the head. I had an 8 millimeter hemorrhagic stroke in the prefrontal cortex on the left side. Nobody cut open my head. You never cut open the head. So if you're not going to open the head and go take a look and fix something, you have to treat it differently. You really have to look at curing it differently. So what do you need? I don't know is the answer. I don't want to give people the impression that I know. What worked for me was cognitive behavioral therapy, structural energetic therapy, neurofeedback therapy, hyperbaric oxygen therapy, ice bath therapy, in combination with meditation and a little bit of peptides and running and walking and drinking lots and 1 month later I was 100% cured, and a month and a half later I had designed and developed this program. So it's like my mind went from not being able to work to being able to be on overdrive. Right. So you kind of have to think to yourself, whatever works, works. Now, science wins over BS every time. Right. But what works does work. So you got to kind of give it its due when it comes to brains, because you're not cutting the head open. So that's just my opinion.
Yeah, absolutely. That's really fascinating stuff. If I had to ask another question, I think I would want to ask, from that list of things that you gave me in terms of the things that you've put into that bundle that have worked for you, at least. Obviously, I have no TBI, and a lot of people listening won't have any kind of a PTS or any kind of TBI problem or something, and they're just looking to optimize at least their lives and stuff. Out of the things that you've been trying and the things you've been experimenting with, and these and things like the cold baths and the ice baths and things like this, what have you felt, or what do you know has been at least some of the most effective stuff to do, which you think me or anyone listening should also kind of be interlacing into their life, either professionally or in sport or in anything, which could be fantastically beneficial for health?
So talking about that, it's one of these, we look at this whole program and we said, okay, if it can help somebody that has a traumatic brain injury, what can it do to somebody that doesn't have a traumatic brain injury? So we wanted to know the answer to that. So we did it to a couple of people that didn't have traumatic brain injuries, and they had a substantial increase. So an increase in coherence, a decrease in phase lag, a betterment of their overall thought process. Now, these are just hard to describe sort of things, right? So you have to be able to work through them. You know what I'm saying? But with respect to the generalized person, they could get better in this kind of a program, and all of this stuff helps. The ice bath helps. The cognitive behavioral therapy helps. The neurofeedback therapy, the hyperbaric oxygen, structure energetic, all stuff that I do to myself on a regular basis, or have done by one of the providers that we have here on a regular basis.
I mean, something like an ice bath, for example, that's something that, obviously, like I mentioned with my sports background, is something that I always assumed was mostly for muscles and muscle recovery, at least like in the legs after a tough tournament or a tough match or a difficult training day. An ice bath was kind of the that thing to go to. But from what you're describing here, it sounds like the benefits of something like that are actually far more than just a sore leg. So how deep does an ice bath or something go in terms of not just that muscular recovery? How does it affect the mental side of things too?
Yeah, so 100%. As I'm driving home with my traumatic brain injury, once I started treating myself here, right? As I'm driving home, I saw a sign that said ice, 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 $5, right? You've probably seen it on the side of the road. You can go get a bag of ice for $5. And I went, huh, what happens to your peripheral perfusion, the perfusion in your legs and your arms when you go in ice water? You shunt to protect the core, but the volume of blood doesn't change. So if the volume of blood doesn't change, you must increase the blood volume here and the only thing that's out of the water, which is here. So it's physics. You have to increase cerebral blood flow, right? So that's the first thing. We haven't even gotten to all of the great things that come from ice bath, including, sirtuin activating compounds, 13% increase in brown fat, cold shock proteins, turning on these things that you don't, look, we used to get chased by saber-toothed tigers when we were, a young sort of a human, right? When humans were young, they get chased by a saber-toothed tiger. When we did, you'd have all these things that turn on. We are in stress. Let's go. Let's turn on all the systems. And your body did that. We don't have stress now. Our biggest stress is whether or not somebody likes something on our Facebook or Instagram post. Come on, so man. True. There is no real life or death, no kidding stress. Like when you drop yourself in 32-degree water. Not when you drop yourself in 50-degree water. Not when you drop yourself in 45-degree water. When you drop yourself in 32-degree water, freezing, there's a reason why it's called freezing water, right? Because it's cold. So, you are trying to induce all of these proteins that are made to turn on when your body's being stressed. And when they do, they're there to help you. Like an increase in interleukin 15, a powerful antiviral. Why? Because you're running from this predator and maybe you'll step on a twig and you might get a virus from whatever. Your body just turns on all these things, right? So anti-inflammatories, boom, why? Because, I'm going to be running, so I need to,
What are the effects of that on someone who's living a very sedentary lifestyle right now? So at least for me, I've always been a big advocate of at least having something every day or every week where you're actually very scared of it, which puts you in that position where you have to overcome at least what's a mental challenge. Something I've been doing recently is bouldering and climbing because I have a slight fear of heights, and overcoming that is like one of the most profoundly great feeling things I get to do at the moment. And things like this, challenging yourself, but also, like you said, being in the situations where you go into that fight or flight mode. But you've kind of listed out the benefits there of why we should have that. What is the repercussions of not having that? So like you said, in the lifestyle that people tend to have in society nowadays, that sort of stress level tends to be at the extent of finances and work and relationships and stuff. Right. And that's definitely not something that's life-threatening. It depends on the relationship, I guess. But but what are the effects of that if you don't have that on you? So what is that doing to us if we don't have that experience in our lives?
Yeah. So what is it doing? That part I can't really answer very well, but I know that as Americans, we are increasing our sedentary lifestyle. I know that as Americans, we are less challenged in general. And you can see what it looks like on the American population. We have climbing rates of obesity, climbing rates of heart conditions, climbing rates of problems, climbing rates of people that are just lethargic in nature and not able to have the right thought process or pattern. So what is it actually doing? I have no idea. But here's what I can tell you. I can tell you that a 13% increase in brown adipose tissue brings with it mitochondria. Mitochondrial-rich fat is good fat. And that is a big check in the win column, right? We're talking about making people better. That's something that makes people better. 250% increase in dopamine, right? That is a rush that you'll never have. An increase in metabolism. Why not, right? These things all coupled together. You sit back and you go, yes, I should challenge myself daily. Yes, I should work better. Yes, I should do more things. You know what I'm saying? So that's the kind of stuff that, but this is a lifetime of spelling gym with a G instead of a J, right? Jim is spelled G-Y-M to me, baby, not J-I-M. So, that's the stress that I want. Do you want to have stress over your checkbook and your job and Instagram likes and posts and whether or not Susie likes you or Johnny thinks you're cool? Nope. I want to have stress from weight being pushed off of me. I want to have stress from the cold. I want to have those real physiologic stresses, not the psychological stresses.
Does that simulate that then? That's interesting, because what you were saying was kind of, at least what I was understanding, was something where you're at least sort of slightly fearing for your life to some extent.
Mm-mm.
So
Nope.
going to the gym, like, I mean, give me a list of what someone could do going forward from this podcast to add into their lifestyle, like a list of a few simple things they could do to at least improve upon what we've just discussed and add a little bit of that into their lives. So obviously you mentioned their gym, potentially ice bath, anything else?
Yeah. So think things that will make you uncomfortable, right? Don't put your hand on a burning stove, but expose yourself to heat that is safe for you, right? Don't don't get exposed to cold air gas. Why? You are made of liquid, right? All of these places that have cold nitrogen or cold carbon dioxide, and they just, that's a good way to get frostbite, right? Because where is all of the energy? The energy is in the state change operation, right? It's physics, right? It's in the state change operation, going from a gas to a liquid. So you want to do these things intelligently. This is why I get in the ice bath in the water, because I'm made of liquid and the water is liquid. No state change operation, right? I'm not going to kill myself, but you can frostbite yourself in an air thing. So things like that, a smart approach to physiologic stress, right? That's the best thing. Your body gets a little physiologic stress, much better.
Does it matter
As
when you
you
do that?
think about it, as you breathe, go ahead.
Does it matter when you do that? Is it something that you should aim? Because I mean, I've heard a lot of varying tales, at least in terms of when you should aim to do things like an ice bath or something like this. Is there a difference between when you do it, like for example, in the morning or the evening, or is it something that you should interlace just every day at some point? How does that look?
The answer is we don't know. This is a very, very, very new science. Like I'm doing electroencephalograms on people that are in the ice bath, and one of my master students is actually collecting data and writing that up right now. So
Brilliant.
when to do the ice bath? No idea yet. We haven't even gotten there yet. It's so new that we're just still trying to figure it out.
Great. Okay. Well, I will certainly be keeping a keen eye out on that. So it's a really, really interesting subject, and I've shied away from the ice bath for too long. I should probably get onto it. But so going forward into the future, then. So last thing I want to touch on from what I've seen on the website and what you're up to is that you're doing a lot of work, and your mission directive is aimed at off-planet survival, and you're aiming to quote travel into space in 2026. I think is what I read. So can you round off this podcast with what your vision is really for your own future with what you're doing, and how important the work you're doing around inspiring kids is to this too?
Oh, great. So I'll tell you this. The reason why I stayed underwater for 100 days is I couldn't afford to stay underwater for 200 days. 200 days is the length of time it's going to take us to get from here to Mars. So I want to know what happens to the human in an isolated, confined, extreme environment. I don't want to go to Mars. I don't have any desire to go to Mars. 2.4 billion years ago, Mars had an atmosphere. 2.4 billion years ago, the Earth didn't. Then cyanobacteria went nuts. They started multiplying, giving oxygen, and we got an atmosphere, and Mars lost their atmosphere. I don't know why we're going to Mars. I keep wanting to ask. I'm like, Elon, I have so many questions, right? Why are we going to Mars? Why are we not looking here on this planet? But if you're going to go, be smart about it. Let's figure out how to get the person to travel from here to Mars safely, efficiently, effectively, right? What do they need in their human body to be prophylactic against ionizing radiation, which we're going to come across radiation when we go to the sky, guys. We're going to be out of the into the radiation belt, if you will, or out of the radiation belt from the magnetosphere that protects us from the sun's harmful radiation. So we're going to be outside that, and we're going to be traveling far and long, and people might get hurt. So we want to protect against that. People stay on the International Space Station for 200 days. What do we do when they come off the plane? We have to carry them, right? Why? They lose muscle. How do we keep muscle going in space? How do we make bone more dense in space? What are we going to eat? What are we going to drink? Yeah, oh my God, there are so many questions, right? So I'm trying to solve these questions in some way, shape, or form and push that rock up the hill continually, right? So it's important, not to me, but to society where we want to go. We want to live off planet. And I'm like, I humbly suggest we learn to live on planet, figure out everything that's here, and figure out what we can do here on this planet. That's my opinion. But space is a great place to learn stuff. So if you want to go to Mars and figure out why they lost their atmosphere 2.4 billion years ago, rock on with your bad self. I will help you get there. I don't think it's so smart, but I'll help you get there.
Brilliant stuff. Um, okay, so last little thing then I'd like to ask, something I've added into the show over the last couple of episodes then, is if you found a 13, 14-year-old Dr. Joe, maybe not doctor back then, but Joe Dituri walking around the streets, what would be your life advice to him? What would you say to him going forward?
Wow. Okay. So I have an admission to make, and I'd like to let all your listeners know. When I was in grade school and high school, I did not do very well. I did so poorly, as a matter of fact, that on the standardized aptitude test in the United States, I got the lower 2/3, which I got a 910 on my SAT, which is graded up to 1600 at that point. So I was about 700 points off. Actually, I was in the lower half, right? So it's graded 1600 and I got a 910. So I was in the lower half, right? I could not go to college. Do you know why? I didn't know how to learn at that point, and schools were uninterested in teaching you how to learn. They gave you this method of learning, and that was it. But I learned like this. So now I love it because I have a PhD in biomedical engineering. I understand the way the world works, and I learned how to learn. What I would tell my former self, dude, it's gonna be all right. You're gonna figure it out. I know you're struggling right now. Just keep going. Just keep going. Don't let the naysayers push you down. You are enough. You'll be fine.
I love it. That's a really, really nice send off. And you certainly give some really, really profound advice. And I'd love to know where we can find more about that. So that's the 4 questions for today. Before we wrap it up, shameless plug away. So, Dr. Dituri, feel free to take a minute and promote all of your social media, the stuff that you're working on, and just something you believe in as well that we can take a look at.
Yeah. So I'm an assistant professor at the University of South Florida. So please look up and see if you can come to USF. We have a great med school and we have a great biomedical engineering curriculum. So come on down. Second, www.drdeepsea.com. Same thing, Dr. Deep Sea on almost all the social media. Look me up, tag me, hit me up. I'd love to be able to talk to you. Currently working with the Mayo Clinic on some wearable devices. Hopefully, then I'm going to go into the spacesuit that goes up to the International Space Station. Just got my U.S. patent on that heart rate variability device. So hopefully that'll go into the spacesuit. It's going to be some cool stuff coming up in the very near future. And hopefully we're going to be building muscle in space, baby.
Sounds good. Very last thing to ask then. If there's, as I mentioned, quite a few veterans have been on the podcast before, and quite a few of them listening as well who have had feedback from have also been veterans who've been inspired by certain stories. If there's anyone here listening who's interested in looking into the hyperbaric medicine and at least getting an evaluation, where should they go to look for that? And where can they contact potentially you as well?
Okay, so follow up on the Dr. Deep Sea website, and there's a little box where you can ask questions. I am running a clinical study at the University of South Florida that will treat you in hyperbaric medicine for $0, and it will pay you. So if you're a veteran with PTSD or with TBI, with TBI and it's diagnosed, come on down. The other thing that I will tell you guys, listen to me. We lose men 3-1 over women. Why? Because we say, oh, just toughen up, princess. Here's, toughen up, buttercup. No, don't toughen up. Go get help. Go get help. You should not be ashamed to go get help. I got help. I had a traumatic brain injury and I got help. Thank God I was in the right spot with the right people in the right place. And I had a psychiatrist and a psychologist that were willing to help me because I was in a bad spot. So I know what despotism is. Don't give up. Don't give up. There are people that want to help you. So come to that program at the University of South Florida. It's 40 treatments. The governor of Florida paid for those. So by all means, come on down. The University of South Florida is here to take care of your veterans' needs. So let's rock this, man. Let's fill that study, guys.
Absolutely, Joe. It's so great to see you doing so well, and we can both conclude now that the sky is in fact not the limit for you. So, Joe, thank you so much for joining me today for the Talk4 podcast. Absolute pleasure and an honor having you on.
Thanks, mate. Be well, Louis. I appreciate you. Appreciate your listeners.
It's been great. And guys, thank you for listening. This has been episode 105. If you'd like to listen to the past episodes, go and have a look at the channel. And if you'd like to listen in for the future ones too, make sure to hit that subscribe button and spread some love by leaving a like and a comment. Signing off for now, fights on, and see you next time. Good night.